that that information is secure?
I would assume they're going to say yes. I don't know. That's a concern of mine.
Where would I call to find that out?
I think if you call any of the numbers they give, you're going to have a hard time getting the state exchange. Simply raise that question.
Well, there's probably some PR people I can get hold of.
Yes.
Thank you. Have a seat. Where would you like me to run? You want me to?
You want to pull up the exchange website?
Mr. Goetzmann, we've been focusing constantly on the individual exchanges here for individuals, but small businesses are also having to sign up under the Affordable Care Act. What is your advice to them?
For the small businesses, you're generally referring to companies with under 50 employees. Those 50 and over have a different set of rules. But under 50, the decisions will be, do we continue with our existing plan? Do we have to make any changes? Are there any penalties? The answer, if we do have under 50, there won't be any penalties. So we can renew with our current Excellus plan, MVP plan, whatever carrier you have. We also have the opportunity to look online at the shop exchanges that are opening or have opened October 1st. We would tell you, don't go to the website this week, let them work out their electronic issues. When you sign on now, you're either going to be told to sign on at a later date, or if you get into it, you may end up being terminated from the process. We've been trying to work through it this week and have some experience on that. But those individuals, the business owners, the employees at the business are going to have to decide, do we remain status quo, renew our current plan, change our benefits? Do we go to the shop exchange and purchase it through there? What are the benefits on the shop exchange? Or as a business owner, at this point, am I better off just getting out of the insurance business and saying, I don't do this anymore? I'm going to let my employees just go to the shop exchange or purchase it through a spouse.
That last option is one that it seems to be getting some attention.
Yes.
Is it advantageous under the Affordable Care Act for a small business employer to perhaps cut back hours or employees just to get out from under the regulations?
The health insurance cost for small businesses has been a tremendous burden for years. So they have been looking for relief. Depending upon the population that you employ, it may be a definite advantage to say we're out of the insurance market. If I have 30 employees, they're at the lower income, same with manufacturer here, it's a competitive field, we're paying $10 to $12 an hour. It is definitely something we are going to analyze for that employer. We're going to look at what would your employees be eligible on the individual exchange in terms of their family size, their average income, what would the tax credit be. Now they're allowed to purchase from different insurance carriers. They're not limited to a single insurance carrier like we have been for several years now.
Explain the tax credit that would be offered to employers, though. I mean, isn't that pretty advantageous?
The tax credit program for employers has actually been in place for several years. Very few have taken advantage of it. It's available only for companies with 25 or fewer employees. The employer has to pay 50% of the premium. And when you look at the tax credit charts that they've had, generally you're really getting down, and the income, average income has to be under 50,000. So we are limiting who's going to get that credit as an employer.
If the income is limited to 50,000, then doesn't that give a certain motivation for an employer not to exceed that amount of pay for an employee then? I mean,
well, what they're targeting is certain groups, obviously. Are we going to go to a white-collar group of physicians or attorneys, architects? Probably not. The credit would be minimal or non-existent. But again, several years now, as I stated, and it's been very beneficial. He wanted to provide health insurance to his employees. Their lower income, he paid approximately 90% of the cost. Now he's getting a tax credit for it.
I think you indicated to me that we've seen like the cost of healthcare for businesses increase by double digits
Yes.
over in recent years. Do you feel that's in anticipation of the Affordable Care Act kicking in?
The recent increases, in our opinion, have been more substantial than what we've seen in previous years. Depending upon the product lines, to say that there's been an average of 12% is fair in this marketplace. With 12% increases, you're looking at every 6 years a doubling of the price. That's what happens with compounding.
Mm-hmm.
So we have a $400 family rates 12 years ago, doubling to $800, and now they're up to $1,600. Employers can't keep up with that, nor can their employees, so we've had to reduce benefits to counter those increases.
Do we see any relief in sight under the Affordable Care Act and that kind of increase?
The theory has been for years, when they put preventive care in, that you have to cover preventive care with no copay to the employee. Obviously, that's a benefit to anyone who has insurance. Anyone from a routine physical, our females can go under their mammography, pap smear, routine OBGYN at no cost.
Mm-hmm.
Long term, we should see benefits to that. By people going and having these preventive services done, we will catch things in the early stages and thus be able to treat them earlier at a lower cost. Immediately, we're not seeing, I guess, the cost reduction from these laws that have been put in place. We're being charged for those, so our expenses have gone up, but we haven't seen the corresponding decrease in medical costs yet. We should over the years to come. But to your question, do we think the insurance companies have been increasing their premiums, getting ready for the implementation of the exchanges on January 1st and making changes to the Affordable Care Act requirements? My belief is yes, they have been increasing the premiums, getting ready for this.
So what would happen, do you think, after everything is kicked in, and what year next?
Well, January 1st is a big year. The exchange is open. The insurance companies were, in theory, going to get a large number of new members. Their hope was that there'd be primarily young people who will pay their premium.
Yep.
And not file much in the way of claims. In the end, we're looking at a medical loss ratio. How much premium versus the claims. And hopefully the premium exceeds the claims, and thus we're controlling our costs. And if we got a lot of those young people in to pay premium, and you've heard this on a national scale as well as locally, then it would be beneficial to the insurance companies. The way our exchanges are working in our marketplace, there's some potential problems with the way it's all falling out now, though.
What would cause those problems?
Excellus is the dominant carrier in our marketplace, have been for many years. They entered the exchange with that idea that if they're competitively priced, they would get a large population of new insureds, hopefully healthy people who would not submit much in the way of claims.
Mm-hmm.
The way the exchange is looking now, there are two carriers who are well below Excellus in terms of price, Fidelis and now the Freelancers Union, which is going by the name Health Republic. Health Republic is a co-op out of New York City. Just started. As of today, they don't insure anybody. As of January 1st, they should have, it's a question of how many hundreds of thousands of people will sign up. Good for our marketplace in the sense that Onco just hired 40 people to do the back office claims administration for that organization.
Right.
But as a co-op, they're member-owned. The idea would be that they will decrease the cost. They're not in it for profit. Part of the healthcare reform law that was passed in 2010 was they were allocating, I believe, $5 billion to co-ops nationally.
Mm-hmm.
That was later cut to $2 billion. Now, out of that $2 billion, Health Republic, the Freelancers Union, received in excess of $350 million of it, I believe, which is over 15% of the amount that was allocated. It's a pretty sizable amount. They're using that subsidy basically to enter the exchange marketplace with extremely low rates. They're going to get the healthy population that all the other carriers want. Where does that leave Excellus? Excellus is going to probably attract in this exchange the people who are concerned about their doctors, their specialists, their pharmacies. The people who use the plan are actually going to be looking at the networks. They're going to be making decisions upon where are my doctors, and they're going to choose Excellus. So Excellus, in my opinion, isn't going to get those young, healthy people that they thought they were. The young, healthy people are going to be looking at the price more so than the network of doctors.
But if they continually go by the price with what Health Republic offers, does Health Republic have the financial wherewithal to fulfill its obligations?
Well, they were given $350 million. How fast they burn through that, we don't know. But if you look at it economically, they're going to take a big chunk of that money and use it to basically subsidize themselves and get themselves up and running and pay the claims. But if I were entering the marketplace, I would have done exactly what they did. If the government had given me the money, you're all in. Let's use this money. Let's get the membership immediately. They're going to get the young, healthy people. In my opinion, that's what's going to happen. They have the price, and that's what the young, healthy people are looking at. Again, if I'm young and healthy, I don't go to the doctors that often. I may not even have a family physician. I'll just go to whoever's in their network.
Okay. Well, I thank you for, it's a lot of information. I appreciate your help.
Well, you're welcome.
Get a couple, 2 shots. Just be talking with Jim.
Did I cover the points that you think I should have covered? Or
I think you did. Did I go off topic again? I didn't do that.
You don't go off topic, Ken.
We talk about so many things.
And what happened?
Earlier in the meeting, you asked what we do. We're an employee benefits consultant. We field a lot of questions from people. The best way to get those answers is actually to go on the website, go through it step by step to see what people would be going through. I spent 20 minutes on the website yesterday entering my name, the names of all the dependents, my social security number, my date of birth, a lot of confidential information. 20 minutes into the process, I was terminated from the website and went to an error message. So I had concerns as to what happens to my information that I put into the system. It's not information, obviously, I want out in the public. Because I did not log off, is it just still there? Is it open? Who has access to it?
And you don't have a clear indication of whether that information is secure?
No, I tried to sign back on again using my username and password. I could not even get back into the website. And they're extremely busy this week. It is a new system. It's going to take some time to work through the kinks, but I do have a concern with my confidential information now being on there and perhaps being open.
There's potentially thousands of other people who could be in your same,
Yes,
in your position. Okay. Thank you.
Okay.
Okay. Now the shop exchanges,
Yes.
that doesn't open.